Okay, and welcome to another episode of This Week in Hearing. I'm joined by a great guest today, Jan-Willem Wasmann. So, Jan, tell us a little bit about who you are and what you do.
Hi, Dave. Thank you for having me. I'm an audiologist working in Nijmegen at the Radboud Medical Center, and my main work is dedicated to patient care. Little bit part is training other audiologists, and there's also a little bit of research. But by working with patients, that's something that really fed new questions for what kind of research is important and what kind of questions do really impact the care we deliver to our patients. And I've studied physics and finished this in 2010, then briefly worked in aerospace. But I had this feeling that aerospace is really innovative, But then I discovered that, for instance, for building a satellite, you need 15 years and then you see the result. And I'm a little bit too impatient to wait for 15 years and changed to medical physics, got experience in audiology, did this training in Utrecht and started working as audiologist in Nijmegen in 2015.
Well, so that's awesome.
My background.
Awesome. Well, thanks for coming on today. The reason I wanted to bring you on is, I think that this network that you've helped to form, the Computational Audiology Network, is really, really interesting. Something that, I look at as being really a pioneer in how the shape of audiology will look in the future. I think that a lot of what I've gathered from your group, and I want to really give you an opportunity to discuss how the Computational Audiology Network came to be. But, a lot of electrical engineers, a lot of research audiologists, AI experts, machine learning type work that's going on. And, I just find this whole field to be fascinating because I think that we hear all the time these sort of surface level assertions of, the future of hearing aids is with AI. But I don't think there's a whole lot of discussion that's happening in the quote unquote, like mainstream within this field of what that actually really entails and what progress is being made around that. And so I figure you're probably as best suited as anybody to really talk about the nitty gritty of what's going on within this whole computational audiology side of the industry. So why don't you share with us how the Computational Audiology Network came to be, and then sort of how you would describe this network and this whole field of computational audiology?
Well, I think it's important to realize that our hospital has really a network approach. So I'm working as an audiologist within an ENT team, but there's also a lot of other departments and there's a university. So there's a lot of knowledge about, for instance, artificial intelligence on our campus. And there is the biophysics department. So there's a lot of research going on there. And that's led to conversations about projects, what we could do, and using artificial intelligence, for instance, for fitting cochlear implants or for better create new tests more efficient. And this kind of conversations with people here directly actually working with me led to this idea of computational audiology, of combining machine learning and audiology. And I think the one sentence summary is applying complex models into clinical care. Those models can be complex, like based on deep learning, or it could be, I think, the null NL2 model of how you would fit a hearing aid is also a complex model. And the clinical care in itself, of course, also really complex in the sense of persons having a lot of different hearing difficulties, and the best way to interact with people, help them, counsel them, and give proper rehabilitation is in itself, of course, also complex. But combining this is, I think, what has led to computational audiology. That the idea was that with these new tools, we can improve our reach. That if working here in ENT and audiology clinic, see people in a consultation room, I'm able to help maybe 1,000 persons a year or 2,000. But if we're able to scale up by remote care, by using tools to triage people that are at risk and invite them into our clinic, while maybe sharing other best practices that can be used at home or at their local practitioner, that kind of skill differences in skill, I think, is something that can be enabled with these computational approaches, with automation, actually with the whole fourth industrial revolution. If you want to apply this to audiology, then what emerges is what we describe in our computational audiology perspective paper. And this group that was via my colleague Chris Lanting, I met Dave Moore. Dave Moore introduced me to Dennis Barber, who is an expert on machine learning audiometry. Yeah, those people together with the Wetswanepoel from Africa really broadened our perspective, that instead of only looking how would you use this technology in the Netherlands in an infrastructure that's already on a high level, so you have to compete with a high level of protocols and new technologies have to surpass this. We changed our perspective on, okay, if we look at the global burden of hearing loss, what would then be the impact of these new tools? And what we describe on the website is a mission of how to improve the situation for people that suffer from hearing loss, either by detecting hearing loss earlier, preventing it, or providing new tools or maybe cheaper tools, and using research or developments from engineering or clinical insights. I mean, best practices of how you best help people in a teleaudiology setting. If we are able to share those lessons and work together with all these different disciplines, this multidisciplinary approach, that's together, I think, in a nutshell, what is the Computational Audiology Network. Many different people from different backgrounds, from audiology, from artificial intelligence, from engineering, from clinics all over the world. While we were thinking about these projects, we saw that these discussions from different viewpoints are really important to make progress and to understand what's important. And we thought if we can create a platform where people can share their views, and that happened at the time that there was lockdown in the Netherlands, that we knew that there were students, PhD students, suffering from being locked in a room, not able to chat with peers, and maybe working in a really specialist field with not so much feedback from peers. We thought if we are able to have interaction between PhD students, other students, clinicians, experienced scientists who can help early career researchers, that can improve projects. And if it improves projects, it may in the long term help us better to address the global burden of hearing loss.
That's great. Yeah, when I was really kind of like digging in and I was saw that you had the conference that you're all going to put on, and we'll talk about that a little bit toward the end, is the conference, the virtual conference that you've hosted the last 2 years. I was really just impressed with the caliber of researchers and scientists that were all contributing. And I think it's great that you have this whole network and you've just launched a podcast. I listened to the first episode of it and I thought we could maybe talk a little bit about that episode, because I think it obviously, the topic there is all around machine learning. And so that episode was titled Bayesian active learning. And so I figure, this is obviously, it comes from probably some scientist that has the last name Bayes. So I figured you could maybe share with us Why was that the first episode? I know you had a number of other folks on there. It sounded like I know Dennis Barber was on there and a few other electrical engineers. So I would love to just hear about why Bayesian active learning for the first episode, and what is Bayesian active learning in layman's terms, so that for those of us that aren't as immersed into this world as you, how can we kind of wrap our heads around what this all kind of means and how it applies to the field of audiology?
Well, the reason we started with this topic is that we had been conducting a scoping review about automated audiometry, looking in all technologies or approaches available that can reach clinical accuracy, so that it's all calibrated and that the results would be of similar precision and accuracy as you would have in the clinic. And we knew that there had been automated audiometry scoping reviews before, or systematic reviews, but the last one was from 2013. And of course, there has been a lot of development, including machine learning techniques. So while we were reviewing all these different approaches, we found two groups that had published an approach based on Bayesian active learning, and a third group that had been working on it, but from a different perspective, not with the clinical validation that we required. But that was all we could find. So one of the conclusions was, okay, so at this moment, there are, on a global level, 3 groups working on this with slightly different approaches. So let's ask them what their motivation was to do this. How can you explain this approach? So that's what I can continue now. Bayesian active learning is a fully adaptive way of testing, where you use all previous results for determining what next stimulus you are going to use. So instead of using Westlake as a procedure for audiometry, where you have a fixed search grid, you could look at audiometry as determining a threshold which is moving through a field of frequency and intensity. And then you try to find the boundary that makes the difference between audible sounds and sounds you're not able to hear. And if, for instance, I would see somebody on the street, my first assumption would be this person is normal hearing. And then you can test this hypothesis by providing a sound and ask that person, do you hear it? And then you see if for instance, you provide a sound on a low intensity level, okay, this person didn't respond, so I have to change my hypothesis to maybe a moderate hearing loss, and et cetera, et cetera. That's, I would say, how Bayesian active learning works, that you do hypothesis testing and you start with some basic assumption, and then you could say that's a model. For instance, what some groups have done is, based on your age, maybe you already have a prediction, this would be most likely your hearing, and then you start testing it. And you can define what are the boundaries within what you're looking, and what's the, you could say, resolution or the step size you're taking for this search. If you're, for instance, screening for hearing loss due to maybe high sound levels, then you could say, okay, we're only looking at the higher frequencies where we expect damage in the ear. And so during this testing, you're continually updating this model and determining or estimating what is the next point where you have the highest uncertainty. And there you do this hypothesis testing by providing another stimulus. And Dennis Barber has published a couple of papers about this approach. Joseph Slittelacher from Cambridge has also done this. They've shown also nice graphs of how, with already a few stimuli, maybe 20 stimuli, you can determine a full audiogram. And this is something that's fully automated. Well, if you want to use this in clinical care, then of course it's also important, is the response by this subject really the response? Is the test proper? Did people pay attention when the stimulus was presented, etc.? These are also things that you can account for when you use this machine learning by adding another uncertainty that you can test for. And the reason that I think this approach of active testing, where you more are actively searching for the solution than more the passive testing, where you have this fixed grid, and regardless what's happened before, you just follow your fixed recipe. The interesting part is that because you can faster find a model that's close to somebody's hearing status, you can choose to do less stimuli, or you can choose to add more variables, not only test for hearing thresholds, but also test supra threshold stimuli and test loudness, for instance, or test other factors that you think are important for your clinical question.
Yeah, I feel like one of the things I kind of took away from it, I know when you were talking on the podcast, one of the applications today is that you can trim down the time it takes to test somebody from like 5 minutes to 2 minutes, which is, it's great. But I think that, as I kind of gather what you're saying, and I think about this from like a remote care standpoint and how you're saying that this can be automated, it seems like, again, one of the most promising aspects of hearing loss, like in the war against it, is that I think one of the greatest weapons that we're going to have toward it is the ability to increasingly provide more sophisticated ways in which you can do a lot of the audiology remotely, and relying on things like this. And so I feel like, when we talk about the ability to see, you're limited in the amount of people that you can see on a day-to-day basis. You just only have a finite amount of time. And so if you can start to implement tools that allow for a more outsized impact, that's really exciting to me. And I know you had mentioned Devet Svanpool, and everything that he's doing with HearX is kind of along the same vein, which is like these digital tools that I just feel as if we're kind of like in the early stages of that new foray of audiology. But I think that, looking at the work that you all are doing sort of on the forefront of how these types of tools can be made better, and these different like learning modules that the machine learning is being built on top of can just increasingly get better and better. It just feels like we're moving in this direction where we really will have the ability to combat hearing loss at a much greater capacity, because you'll be able to do so much of this will be automated in such a way, I feel like.
Yes, I fully agree. Yes.
So one other idea is, or one other thing that I wanted to touch on that I thought was fascinating when I was listening to the episode was, this whole theme of, how the audiogram is like the gold star use case for active learning in healthcare, broadly speaking. And I felt like that's another really interesting thing, is like audiology in a way is kind of sitting at the focal point of machine learning in healthcare, broadly speaking, because of the test box that it provides. So I wanted to give you a chance to speak to this a little bit, because it sounds like some of the folks within the Computational Audiology Network kind of came to this same conclusion, on their own. And then now you're all building on this. And I just want to speak through a little bit about what the implications of that really are within the broader scope of healthcare and medicine.
Mm-hmm. Yes, I think there's different aspects that 3 years ago, when I thought about all these really promising deep learning techniques, all the examples I knew were in the visual field, for instance, in image recognition. And I was not aware of how much progress there's also happening in sound recognition and classification. So one of the things I thought that's important to realize how quickly and impressive also these developments are, but it's something I think much more complex to explain. That if you show a picture and then say, well, the computer is able to interpret this image, people can see, wow, that's impressive. But with a sound, it's more difficult, I think, to show this, to demonstrate this. So I was also really surprised, no, not really surprised, but I was impressed by what Joseph Schlitterlacher said about, indeed, the audiogram being the ideal test bed, in the sense that it's not intrusive to do this test, and that it allows for proper problem definition and making assumptions and test those assumptions. While in other applications within medicine, where you, for instance, have to take a blood sample, if you then take a blood sample and it was not needed, well, that's of course something that's more intrusive to do, while also something that's really important to do efficiently. So if you're able to test these kind of tools or in a field where the effect is not so damaging or serious as in audiology, that I think makes it a good test bed. But also we already do a lot of simplifications by determining a number of frequencies where you could say, well, maybe it's not necessary to test in between frequencies or go for another arbitrary precision. But it's also something that we are not able to add, for instance, that if people show up in the clinic with tinnitus and maybe with smaller lesions in their inner ear that go undetected if you follow the normal grid search, then that's also something that maybe with these machine learning techniques, you could continue testing and find these small lesions and maybe explain the underlying cause of the tinnitus, or other questions, of course, that we do not address now and that we maybe call hidden hearing loss, because it's beyond the sensitivity of the instruments we now have at hand.
Yeah, I think that I love that whole idea of like just being able to use a more comprehensive evaluation to detect these types of things, and using the machine learning modules that are, really good at determining all of these kinds of things. So I guess as we kind of come to the close here, I just want to give you a chance to plug your conference that you've, I know this is year 3. So maybe just kind of a broad, strokes of what this conference entails, what the first 2 years were like, and what people could expect if they're interested in joining in this year around on year 3.
So, well, with the conference, when we started, the idea was we just invite people from audiology and AI, let them tell about their projects, maybe even ongoing projects, so that we can discuss it and see how to improve it. And I think we just launched in April 2020 a call for abstracts, and we were overwhelmed by responses from the community. You could see from hearing scientists, but also from small companies that had developed new tools. And I expect that there were probably a lot of people that had some abstract or a talk that they were going to give, but they were not able to do this. And now I realized that there was also a personal motivation to create this platform, that I had this talk that I would give in June that year, but that whole conference was canceled. So I had a story to tell, but no podium.
Nowhere to tell
and
it.
And then we thought, well, with this virtual approaches, with a virtual conference, we are able to do this, but also lower the barriers for participation. So for people who are not able to travel for 4 days to another continent, you can lower the barrier. So we made it free for everybody. And what I still are really happy about is that we were able to have people from renowned institutes telling about their latest ongoing research, while also people from India, Nepal, South America joining, listening to the stream. And what we also did was, and that's something that was really inspiring for many people, we organized a workshop for patients. So we had a person from Australia, from Africa, from South America. And I remember how this guy from South America, he was in his early 30s. He explained that he had to travel from Bolivia to Mexico to buy hearing aids. And he was telling his story while using an app that translated his speech to text and vice versa. So I was seeing this new Google technology used in a different country, while here in the Netherlands, I didn't see people experimenting with this. And that was something that showed how powerful these new innovations can be, that if it works in South America, it can work in the Netherlands and vice versa, since 90% of people globally have smartphones, and many people have the latest smartphones, so they can use these kind of innovations. So not only were there the traditional scientists and engineers, but we also saw new players with app developers, for instance. And another thing that was overwhelming, that when we published this call for abstracts, I think in the next days, somebody suggested, well, maybe we can organize a workshop. So that was Al O'Brien, who told us, well, I can explain something about the whole machine learning pipeline, how that looks like, and we can throw a workshop. And by her enthusiasm, we decided to also organize a workshop about patients and their needs globally, another workshop about how to develop apps, another one about how to do low-touch audiology, since we were in this lockdown and many clinics were experiencing the same problems. And that's something, everything was developed within 8 weeks, and it was a really intense time. And I was really lucky with a lot of support from the Radboud University and the hospital, with the researchers here, but also almost everybody who we asked to explain something about what they were doing. People renowned like Van Gang Zeng or the Wet they all confirmed, well, they were eager to join it. And there was a kind of probably enthusiasm that we were the first to embrace a virtual conference, and also using these new techniques without trying to emulate an actual conference, physical conference. We thought, we know that the listening span is shorter, so maybe just short presentations of 2 to 5 minutes, and it could be pre-recorded. So we had these pitch videos that you can still watch. That was something that we decided to use, so that there was only short talks and more time for questions and answers. And after this conference, I was really lucky that Tobias Göring from Cambridge, who enjoyed the conference, that we could convince him to do a next conference, a follow-up activity. And I think he took it to a next level with expanding the network, more renowned researchers, but also I think he improved the quality and made, I think, our approach more consistent, while still keeping it free for everybody. And I'm really glad also that now Oldenburg, together with Hannover, the cluster of excellence in Germany, is now organizing this next conference. And again, I think also in this edition, there's really new developments like virtual reality applied in audiology. That's something I think for clinicians is really interesting to know what these developments are looking like and how it can change your practice. E-research, for instance, but also how machine learning is used, and these new algorithms are used in the next generation of hearing aids. Or another thing is the special session on predictive coding, so also the complex models, how that is developing. I think that's really exciting that we will have these special sessions, and of course abstracts from research groups from all over the world, and it's really international. That's also, I think, something which distinguish this conference from others, that all continents and many nationalities are involved.
Yeah, I mean, I think that, just for my own personal curiosity, I would love to, join just to see what's on the bleeding edge of the science. And I feel like what we're likely to see there, and I agree with you. I think it's really neat that it's international. So what's going on in Africa, what's going on in Europe and Asia, like what types of things are being studied and worked upon. And you can get a sense from there, I would imagine, of what's coming down the pike then, whether it applies to in the actual clinic itself or with the product offering in the future of the technology. So, I mean, if you want to peek behind the curtain of what's coming down the pike, I would imagine that you should probably attend this conference. So where can I go? Where can I go to sign up and join in and be an attendee?
Well, we're opening the registration April 26th, so next Tuesday. And so we'll share this online on computationalaudiology.com. People that already participated before will, via the newsletter, get informed. And so there will be also, I think, a lot of buzz via the social networks. And here I would also like to thank, for instance, the different platforms like the Hearing Health Technology Matters and other groups that have shared our initial invitation back in 2020 that helped us to reach a lot of people and a lot of different countries and many societies also internationally that shared the link to the conference. And I hope that this conference will again be a window on the state of audiology, and that it's, I mean, normally during my work, I will only see patients from the Netherlands, but now you will see also how in different countries developments are going. And sometimes that can be something that inspires you or helps you. Well, this is something that's gonna impact my practice. Or it can be a window that you think, okay, we have to prepare and maybe make adjustments to better improve it or apply it in our own country. And I hope, and that's something that would maybe be the next level of the Computational Audiology Network, is that the website was intended as a forum so that people could actually interact every day with questions, share experiences, share resources. So there's part of the website, there's a lot of models, but also tools that people can download, for instance, to do a hearing test at home or to do data analysis. And you could say there's only 2 days a year now, the conference, because we have spread it of 2 days, the end of June and the first day of July. But the rest of the year, I would hope that we have this interaction between researchers, engineers, maybe also patients or people that experience hearing difficulties, and that this can continue to inspire each other for improving our work or getting excited about what's coming up.
Awesome. Well, thank you so much, Jan-Willem. This has been such a great conversation. I'm looking forward to attending. I'll probably just be a fly on the wall observing and seeing what's what. But, like I said, I'm still learning and trying to wrap my head around all this. And it certainly seems like it's just going to become more and more relevant for all of us that are operating in this industry, whether you're a practicing audiologist to someone like me who just is supporting the industry by being a distributor. So it's been a great conversation. Do you have something you want to share?
Yeah, that actually everybody who's listening also to the talks, I would say we try to give as much as possible the opportunity to interact. So you can also ask your questions via the chat, or for instance, on the website itself where we publish all these abstracts. You can, for instance, ask your question and we can ask the presenter to follow up and address your question. So I would hope that we do not raise like this, if there's only a small group of people talking and the rest is only listening because they don't dare to ask the questions. I hope that we make it easy for everybody, feel comfortable to, I think, a nice atmosphere. And so far, an atmosphere where there was a lot of trust between people. People will feel free to ask questions, or maybe make appointments for follow-up conversations.
Fantastic. Awesome. Well, this has been great. Thanks for everybody who tuned in here to the end, and we will chat with you next time.